Welcome back to Good Morning America Health. I'm Tanya Rivero. According to the American Chronic Pain Association, about 86 million people in the U.S. endure some form of physical suffering. But it is important to know pain is not inevitable. And as our next guest points out, it doesn't have to be a natural part of getting older either. Joining us now with tips on how to manage, treat, and prevent pain is co-director of the Princeton Spine and Joint Center, Dr. Grant Cooper. Dr. Cooper, thanks so much for being here today.
Thanks so much for having me.
So chronic pain is obviously a big problem in this country. Is that right?
It's a huge problem.
And what would you say is the most common source of chronic pain? Is it the back?
Back pain is probably one of the most common causes of chronic pain in general, and musculoskeletal certainly.
Do you hear that a lot then?
Oh, it's a large part of my day and a large part of the days of people who do what I do.
And now, how do you determine as a doctor the source of the pain? There are MRIs, there are X-rays. Are those the steps that you take as a doctor?
Diagnostic studies, imaging studies are very important. They're important tools that we have, but it's really important to take the imaging studies in the appropriate context. And that context is that about 30% of everybody have disc herniations or disc bulges in their spine and don't have any symptoms. And everyone after the age of 65 has some degree of arthritis and doesn't necessarily have any symptoms from that either. And that applies to the back, that applies to the knees, shoulders, hips. So you have to take the imaging studies as one aspect of the diagnosis, but it's by no means the entire diagnosis. It's always important to treat the person and not the person's MRI or the person's X-ray.
So how do you do that? Do you have a conversation with your patient?
Sure. It all starts with a history.
Right.
So that's physician 101.
Right.
Is getting a complete history, getting a complete physical, and then we also rely on our science, on the research that we have to know what usually causes pain, and then we try to take the appropriate diagnostic steps as they come up.
And how, obviously each case is individual, but the majority of chronic pain cases, how are they treated?
Well, it really depends on what's causing the chronic pain, but in general, the first step is managing the pain, right? So making someone comfortable in the beginning. And then what you want to do is you want to step back and figure out where the pain is coming from so that you can address the underlying cause and hopefully turn it into no pain. When pain is coming from a musculoskeletal origin, so back pain, neck pain, shoulder pain, in general, the arthritic changes or the wear and tear, it predisposes towards inflammation. Inflammation is where pain comes from, and inflammation is basically a cascade of proteins that when they get next to nerves, they cause pain, they can cause numbness, sometimes they cause weakness. And what I tell my patients is that the best way to conceptualize inflammation, and the way that I think about it too, is that it's like a fire. And there's two ways that you can put out a fire. One is you clear out all the fodder, right? You push away the sticks, you push away the debris, and sometimes the fire just dies down by itself. That's therapy. It's physical therapy. It's stretching, it's strengthening, it's posture. It's basically getting the mechanics of the spine or the hip or the knee right to take the pressure off of the structure.
I'm familiar with that because my husband has a bad back, and now he's got a series of exercises that he does every night and stretches.
Precisely, and sometimes that's all you have to do, and sometimes you clear away the debris, you clear away the fodder, and you do a good job of it, but that fire just keeps on wanting to burn. And that's when you turn to some of your interventional techniques to take away the fire. A large part of my day is spent taking away fires and basically resetting the inflammatory clock through either medications or injections, and basically spraying anti-inflammatory medication onto the site of inflammation. Where people sometimes get into problems is when the inflammation is taken away but nothing's done about the underlying biomechanical problems.
So
right?
then it will come back.
Then it will come back often, right, exactly. So what you want to do often is take away the fire and then take some steps to make sure that the fodder is removed, that those exercises, they become so important.
They have to keep doing them, very, very important. Now, you do have some tips, because there are people obviously out there who are suffering from chronic pain and others who are afraid that they may perhaps someday suffer from chronic pain. So you have some tips, ways that people steps they can take so that they don't suffer from this pain. And the first one is stay active, right? Oh,
that's huge. That's huge. We have such a sedentary lifestyle, from occupation and habits and just lifestyle, and our bodies really are not designed for that. Our joints aren't just capable of motion; they really need it. And so getting up and at least finding some time to be active is absolutely critical. Whether
that's jogging for 20 minutes, taking a yoga class, right? It doesn't matter what you decide to do; just do something.
People ask me all the time, "What's the best exercise for me?" And the first answer I have is the best exercise is one that you'll actually do,
Right.
right? Because there are some exercises that are a little more joint healthy, that are going to be a little easier on your joints, probably a little better for you. But the bottom line is that, well, like the elliptical machine or like
Right.
swimming, and
Right.
but if I tell someone to use the elliptical machine for 40 minutes a day or 20 minutes a day, but they hate the elliptical machine, or we design an elaborate program, but the person doesn't like it, doesn't fit into their life,
It doesn't help them at
it
all.
doesn't help them at all.
Right.
That's
So
right.
find something you enjoy to do and do it regularly.
Exactly.
Now, the second thing you say is that don't ignore the pain when it comes up. So don't push through the pain. Is that what you're saying?
That's right. That's right. And also, if you go back to the inflammation as a fire analogy, then the bigger the fire gets, the more likely that you're going to have to do more to make the fire go away. But if you catch pain in the beginning, and you don't just mask it with over-the-counter medications or medications in general, then often it's a lot easier to make the pain go away
So
quicker.
you don't believe in masking the pain, obviously.
Unless you're really up against a wall, that's right. I think it's a lot better to identify where the pain's coming from and then
Right.
make it go away and stay away.
And you finally stay informed. So does that mean do your research and find out what the source of your pain could be?
Not exactly. I mean, I guess what I mean is to be aware and talk to people, but also make sure that you talk to your doctor. I mean, I think that people going out and trying to diagnose all their ailments might get them into a little bit of trouble.
Yeah.
But talk to your doctor, and one of the biggest barriers that we have to treating chronic pain is making people aware that chronic pain can be treated.
Yes.
It's so common that
A
lot of
relief
people
for a lot of people to hear that,
Yeah,
I'm sure,
hopefully,
right? They come
hopefully,
in with a big
hopefully.
smile on their face when they hear. Thank you so much, Dr. Cooper, for all of that. And don't forget, you can follow ABC News Now on Facebook and Twitter just by searching ABC News Now.